The World Health Organization says so far there have been nearly 200 cases of monkeypox reported globally. The health agency says the virus is not a cause for major concern because the transmission rate is slow and that the priority needs to be containing the disease through quick preventative action. The World Health Organization is advising healthcare workers there is no recommendation currently in place to use smallpox vaccines for monkeypox or for mass vaccinations. For more on this, I'm now joined by Dr. Bharat Pankania. He's a senior clinical lecturer at the University of Exeter Medical School and has over 20 years of experience in communicable disease control as well as infectious disease management. Dr. Pankania, we're used to having you on to talk about the coronavirus, so I'm happy to be resorting to your expertise when it comes to this matter. Okay, an outbreak of monkeypox has some people worried that the world is on the brink of another pandemic. Is this because of the mentality that we're coming out of a COVID-19 pandemic, or is there really cause for concern?
No, we need to remain calm and very measured. The COVID pandemic was a different beast altogether. The COVID pandemic was a new virus to which we had no immunity, no knowledge, and we didn't know how to manage it. Whereas with monkeypox, we've known about it for many, many decades. We know what it does, we know what it doesn't do, and we already have the vaccinia vaccine, which is the smallpox vaccine, which provides cross immunity and protection against monkeypox. So to summarize, with monkeypox, we are in a much better place compared to the COVID pandemic, which we are still going through.
You say that we do have a smallpox vaccine for this, but smallpox, as far as I remember, was declared eradicated in the early 1980s, and most countries stopped using this vaccine against the virus in the late 70s. I mean, it means that a lot of us who are sort of 50 and younger do not have immunity to this then.
That is very true. So people aged 50 and above will not have been immunized against the smallpox vaccine. Very true. We stopped immunizing on a global level 40 years ago. Having said that, all I'm saying is, yes, whilst the population is not immune, we've got the armamentums should we need it. My considered view is we won't need it. This is a sporadic outbreak, albeit very concerning because it has happened in many countries simultaneously. But in a way, this is our bread and butter. As infectious disease control management experts, we know how to deal with it. We know what to do. We know what to look out for. Therefore, I expect and I want this to be brought under control. It should be, it will be.
If this is your bread and butter, tell us how this butter is made. I mean, how exactly is the virus spreading?
So this is a person-to-person spread of infection. Of course, you can also get it spread via contaminated clothing or in the early phase of an infection, close personal contact with heavy droplets. This isn't, as far as we know today, a aerosol spread. Our knowledge is that this is more heavy droplet spread. So you're unlikely to get it compared to COVID, which is aerosol spread. It can also be present in a room if somebody was infectious a couple of hours beforehand. This is, you are going to be in close proximal contact or contaminated clothing.
Dr. Bharat Pankania, thank you very much for joining us here on the NewsHour. It's always a pleasure listening to you. Thank you.